Now, today is actually World Sight Day, an annual day of awareness held on the second Thursday of October. This day focuses on ways to prevent blindness and vision impairment. According to a recent World Health Organization study, approximately 285 million people worldwide live with low vision and blindness. People often do not give their eyes the proper care they need. So let's try and give them a chance. And joining us in studio to give us a little bit more education as to how to take better care of our eyes and telling us about National Eye Care Awareness Month is senior optometrist Rudine Diedericks. It's so good to have you on the program. Welcome to Morning Live.
Thank you very much.
All right. So, I mean, we talk about a figure like 285 million people with low or no vision worldwide. I mean, this is huge. So, I mean, eye problems it's a huge thing around the entire world. Everybody goes through it, right?
Absolutely. What's actually more shocking is the fact that 80% of those people could have had proper treatment for their eye conditions if they had early detection. Yeah. So that's actually a bit more of a scary statistic. Yeah. Because it could have all been prevented. How
seriously do people take having their eyes tested and having their eyes regularly seen to?
I think that's a difficult thing to, measure, but we definitely advocate that that's very important, because an eye test is not only about only seeing well and making sure that your glasses are up to date, but it's really a health check, because there are a lot of eye conditions that optometrists can pick up, systemic diseases that we can pick up in the eye as a first line of treatment, identifying a problem and referring you to a proper specialist. So that's why regular eye checks are actually, very important. It's not only about can you see well.
So I may, just using myself as an example, may have something wrong with my eyes that I don't even know about, but going for a test and a checkup, I may actually pick it up.
Absolutely.
Would I not see signs, or would I see signs?
A lot of the eye conditions, you don't actually see signs in the early stages, and that's when it's very effective to treat it. Sure. So it's very important to have your regular eye checks 1 to 2 years, to have these things, go through the paces, let the optometrist examine all of that for you, and make sure that there's nothing, lingering in the future that you can't maybe treat already.
What are some of the conditions you're talking about? What are you referring to? What can you pick up in the eyes?
One can see early detection of cataracts. Early detection of diabetes, where it's starting to affect the eye. Another condition that you actually pick up quite early, that's quite a devastating disease, is macular degeneration, which is more of an older onset eye condition. And unfortunately, there's a category in macular degeneration that can't really be treated very effectively, where if you've had visual loss, you actually can't get it back. But if you can see it at an earlier age, they can treat it before your vision actually goes.
How often do you say that people should go for their eye tests?
We, at Mellon's Eye Style, we advertise that and try and get people to test every year to 2 years. Okay. If you've got a specific systemic condition, like for instance diabetes, it is very important to have it checked every year.
Yeah, yeah. In terms of vision now, when you start sort of seeing changes in your vision, you're not seeing quite as well as you should. What are the signs that you look out for? I mean, there are obviously things and indicators to say, hang on a second, I think I need glasses now, or I better go and get my eyes checked. What are the things you should look out for?
They're very different depending on the age of a person. So if we look at children, that's always a bit more tricky, because they can't tell you they can't see. They don't necessarily know that they can't see better. So things to watch out for in children is if they keep on squinting their eyes, if they're overly sensitive to sunlight or to light. Yeah. If you show and direct them to something and they obviously don't pick it up, excessive rubbing of the eyes, if they grasp at an object and miss it. That is classic things in children that you have to be quite sensitive for. If you see that, they need to go for for a test. Yeah. But in older people, most people will tell you, I can't see this, or I can't see that, or I'm struggling. But a lot of the times your vision's great, you can actually see well, but you've got symptoms like eye fatigue at the end of the day, chronic headaches, my eyes are very tired, my eyes are tearing a lot. Those are all things that's not just, tiredness or fatigue at the end of the day. It could be a visual problem. Yeah. And that's why a test every year to 2 years is very important.
And you're possibly just ignoring it and taking a headache tablet and saying, oh, gee whiz, it's the weather, it's my sinuses, you blame everything else except for the fact that it very well may be your eyes.
And it can be rectified.
you speak about the younger kids, younger generation, and the older generation. Who is more susceptible to eye disease or eye problems, or is it across the board?
I think it's across the board. Your problem just with children is the fact that they can't always, word for you what they are experiencing. A lot of the times they don't know that what they're seeing is not clear because they've sort of grown up that way. So the visual system needs to be examined as early as 3 years, where optometrists have very clever tests to get those kids to, take part in testing and see what they can and what they can't see.
Yeah.
And big problems can be picked up as early as 3 years, except if they've got symptoms before then you have to react on it very quickly.
That's amazing. So from 3 years old, you should be having your kids tested annually or at least twice every year. Let's look at the fact that a lot of communities, and I speak particularly of rural areas, don't have access to the incredible technology that we've got. And how does this affect? Because obviously this falls into figures where obviously they're not being seen to, they're not being treated, and getting glasses is an expensive exercise as well. What happens in rural areas?
I think there are some very nice initiatives, but like anything, it can be bettered. If I can just maybe name one, when we are studying as optometrists, in our 3rd and our 4th year, we take part in the Pelupepa Train initiative, where we go to rural areas and those people get screened and get supplied with glasses. So there are initiatives like that, but I think it can be bettered on a big scale.
Indeed. But like you say, it doesn't go everywhere. So what do people do that don't necessarily have an optometrist up the road or access to that? Can you go to your general hospital? Is that the best place? Are all optometrists based there?
Most of the general hospitals have an eye care facility, I think, but the numbers are just overwhelming, I think, sometimes for the facilities. So there's a lot of room for growth in that area.
Yeah. Any activities that have been planned through the month? Because there's not only National Eye Awareness Day, but this has been since the middle of September up until the middle of October. Are there different activities, things that are happening that you particularly are involved in?
Not that I can't give you a lot of information about that. I think if people are interested in getting information about that, they can contact the South African Optometric Association, and they will be able to assist them further.
Yeah, amazing. We'll get them in. I think it's a good discussion to have, and especially to find out where those areas can go. But people that have access to a lot of money, or not only a lot of money, but also the access to the technology that is out there. There's some amazing developments when it comes to eye care, and I know that you're involved in that as well.
Absolutely. Yeah, eye care has really gone to a level of customized precision, and a lot of advances are making us just be, as optometrists, make us better. We can make better glasses for people. We can be a lot more accurate. But it's very important what you're saying. That's not the only place where we should be focusing. We should be focusing on ground level also, like in this month, just educating people about the prevention of blindness, because a lot of the conditions that those statistics add up to is preventable.
Yeah. There was a graphic that we put up that I'm gonna ask our technical guys if they don't mind putting it back up again. It's an actual picture of your eye. Now, I saw this picture of an eye, and it's quite fascinating to actually see what your eye looks like. And well, there we go, that's the one I was looking for. Well, let's go back. I think it was the one before that. Easy, if we can just go one back. And it's quite interesting to see there we go, that's the one. Now, is that a picture of your eyeball, but a healthy eyeball?
If you look at the picture on the right, that's all the specific structures of the eye, which I just always find absolutely amazing.
It's very fascinating.
And it's so small, but it's so, specialized. If you look at the picture on the left there, also showing the little areas of the eye, but those little bubble-like figures that you see around in the middle there,
yes,
that's actually indicating an eye with possible macular degeneration, where the macula is losing its function.
Yeah.
So that's what we spoke about, which as we get older, we are more susceptible to that. And there's a couple of things that one can do, to get the eye to react slower in a process like that. So if you can catch it earlier, you don't have that, devastating visual loss. Because in an eye like that, what you basically lose your central vision, which is horrible because you can't get that back.
Yeah, that's something you need to look. Can we look after our eyes? I mean, is there anything we can do besides obviously going for regular eye tests, but are there things I can do to make sure that my vision is protected, that I look after my eyes? And the final question is bad eyes genetic?
Yes, there is a genetic component, as we just spoke. If the parents have visual difficulties or they're wearing glasses, it's always good to get the kids in and get them tested early. But in terms of looking after your eye, there's a lot of things that one can do. Your eye is part of your body, and as you look after your body, you need to look after your eyes. So generally, also just healthy living is a very important component for the eye. Things like not smoking. A lot of eye conditions are escalated in the prevalence if you smoke.
Yeah.
Not drinking a lot of alcohol and eating healthy foods.
Amazing.
And also helping the eye by supplementing with specific minerals and vitamins. That's very, very helpful to the eye. Then we must also remember, South Africa is very harsh in terms of the weather, as we've just seen, and it's very hot.
Yeah.
So protecting your eyes against UV is extremely important in a country like South Africa.
So a good pair of glasses. They don't really look good, but they're good for your eyes too as
Absolutely.
well. Listen, thank you so much, Rudine. Thank you for all of the advice that you're giving. And of course, I've got the gallery in my ear saying, what about carrots? Should we eat our carrots? Is it still good
Carrots
for your eyes?
is a good thing.
Okay, good. Well, there you go. See, I can honestly say I have a peanut gallery in my ear that are talking to me constantly. So they want to know, can we eat our carrots? Rudine Diedericks, Senior Optometrist, thank you very much for talking to us here on the program. Okay, this is a story that we